The small group work has been extremely helpful in developing our services for patients who have completed their treatment for breast cancer. It gave us the opportunity to bring patients, staff and some of our partners from the voluntary sector together to look at how we've really developed services for patients at this time.
Within 10-15 minutes of being in the meeting, it was great, and we already had an idea of how we wanted to do things and sort of not the ground rules. It sounds very regimented because it's quite a flexible process, but actually just saying it's all about just making it better for everyone, and actually what we have, if we had no rules and no limitations at all, what we'd like the service to look like and how they like to experience it.
So the patients and relatives spoke about their themes, and they, at the end of their first meeting, had to come up with 6 co-design projects they wanted to take forward. The staff did exactly the same, so they had feedback from the interviews and they came up with their 6 top priorities. So we went together when we had the combined meeting of patients, relatives and staff. We had 12 co-design projects that we could tackle. And then we had to decide a mechanism of consensus and democracy to be able to choose the top 4 that we agreed on.
To me, and I think the rest of the team, it was a very positive experience. If anything at all, in actual fact, it even brought us closer to the patients. And I think the patients understood also where we come from.
So each patient and relative had a kind of a scorecard in front of them where they could write down the things that they agreed with or didn't agree with. They were able to put their own themes down, which they thought were important. We also recorded it, audio recording, and some part of it was filmed as well.
It's quite weird being in a room with staff that you see as a patient, and I have to say I never really got over that feeling of being in a room. You know, I never felt quite comfortable sitting having a biscuit next to somebody who you see as a patient, but it was really good to see a very real response from them.
We would be talking to them, our staff counterparts in a group, putting suggestions forward, like, you know, a member of staff coming and saying, oh, well, we're running half an hour late today and this is the reason why. And the next meeting you'd come to, it had already been implemented. So they were actually implementing things as we were going along, which was, I mean, really, really positive.